Hello everyone. Welcome to the Osteoarthritis Action Alliance Lunch and Learn webinar for March 15th, 2017. My name is Kirsten Ambrose. I wanted to thank you for joining our presentation this month. Our presenter is Linda Ehrlich-Jones, a clinical research scientist in the Center for Rehabilitation Outcomes Research at the Rehabilitation Institute of Chicago. Dr. Ehrlich-Jones is also a Research Associate Professor of Physical Medicine and Rehabilitation at the Northwestern University Feinberg School of Medicine. Her primary research interest is in promotion of healthy lifestyle, both physical activity and nutrition, in persons with arthritis utilizing motivational interviewing. Today, she will share practical applications for motivational interviewing in clinic settings to encourage people with arthritis to choose behavioral interventions such as physical activity, weight management, and education. Welcome, Dr. Ehrlich-Jones.
Thank you, Kirsten, and welcome to everyone, and good afternoon or good morning, depending on where you are. So just have a quick slide here with my disclosures. And then our agenda for today, we're going to have an introduction to motivational interviewing and motivational interviewing spirit. We'll talk about the 4 key MI processes, the 5 key communication skills, and then the readiness ruler. It's a very brief overview of what we're going to talk about today in terms of motivational interviewing and how it is done. If you're interested in learning more about motivational interviewing, I would suggest that you participate in a workshop where you can actually practice the skills with a trainer. And for those of you who are clinicians, I just want to make clear that MI is not myocardial infarction today. We're talking about motivational interviewing. Next slide. Our clinical situations that you can use motivational interviewing could be things such as increasing physical activity, weight loss, medication adherence, some types of dietary changes, or traditionally where it started out, which is addictions, quitting smoking or drinking alcohol. Uses of motivational interviewing, it's not a fix for everything. You can use it for certain conversations centering on behavior change. Next slide. Motivational interviewing is a refined form of the process of guiding. The skillful practitioner shifts from directing, guiding, and following styles in response to patient needs. Directing would be a healthcare professional that takes charge at the time and tells the patient what to do. Guiding, on the other hand, is the patient decides where to go and they hire a guide to help get them there. Following would be listening predominantly and then following the patient's lead. MI does not displace but complements the communication skills you've already developed, and we learn a lot about MI from our patients. We all know that change is difficult, but MI is an opportunity to help our patients make a change in their behavior. Next slide. The stages of change has played an important role in the development of motivational interviewing. So the Transtheoretical model of health behavior change has 5 different stages. The first being pre-contemplation, and that's when someone is unaware of problem behavior or they're just not willing to change at that time. Contemplation, the person acknowledges that they have a problem and they begin to think seriously about solving it, but they may be far from actually acting on it. Preparation means they're ready to change in the near future and they may be on the verge of taking action. Taking action is actually modifying behavior. And then there's a maintenance stage where sustaining behavior change, as we all know, can be difficult and there may be struggles to prevent a relapse. And motivation provides the push to move through the process of change. Next slide. Now, using MI with pre-contemplators is difficult because they don't want to be lectured and they don't want to be given action techniques when they're not ready to change. But it is a good communication style that you can use to help build rapport with the person. MI with contemplators, though, helps them examine their own situation, considering the pros and the cons in a non-threatening and supportive manner, and encouraging them to take responsibility for their situation. Next slide. MI with patients who are preparing for action, taking action, and maintaining change provides coaching. It's helping them to increase self-efficacy and reinforcement of accomplishments in an empathic and caring style. Next slide. There are 3 critical components of motivation, and they include importance, confidence, and readiness. And we'll talk quite a bit about that a little bit later on in the talk. Next slide. Ambivalence is actually a very important component of change. It's actually normal, and it precedes the change. Decisional balance, again, we'll talk a little bit more later, is looking at weighing the costs and the benefits. We have to think about weighing the costs of making the change as well as the costs and benefits of not making a change. Next slide. So the definition of motivational interviewing is a counseling style used to strengthen personal motivation and commitment to a specific goal by exploring the person's own reasons for change within an atmosphere of acceptance and compassion. It's not a technique for tricking people into doing what they do not want to do. It's skillful clinical style for eliciting from the patient their own good motivations for making behavior changes. Next slide. Motivational interviewing spirit is the atmosphere in which we conduct motivational interviewing. It's an interpersonal style characterized by the absence of confrontation or persuasion and by the acceptance of the person expressed by empathy, respect, and support. Next slide. There are 4 key MI processes, and these processes are both sequential and recursive. Think of them as stair steps. You can go up a little bit, go down a little bit. So when we look at engaging, both parties establish a healthful connection and working relationship. There's an agreement on treatment goals and good listening. For focusing, focus on a particular agenda. In MI, focusing is a collaborative process of finding mutually agreeable direction. Evoking, we elicit the patient's own motivations for change and have the person voice the arguments for change. And then planning. It encompasses both developing commitment to change and formulating a concrete plan of action. People are more likely to follow through with a change when they have a specific plan and express that plan to another person. Next slide. There are 5 key communication skills. Open-ended questions. So most of us know an open-ended question is a question that cannot be answered with a yes or a no. But in addition, something that has one specific answer, like where were you born? They're also non-judgmental, and they allow for the person to do most of the talking, usually in their own words. And it lets them know that the conversation is really about them. Affirmations are statements of appreciation and understanding. It supports the person's sense of efficacy and indicates value for their point of view. For example, you're clearly a resourceful person to cope with such difficulties for such a long time. Next slide. The starters for open-ended questions, you can use things such as tell me about, or what else, or what if any, or help me understand, or how did you? So ways in which you can start and use an open-ended question. Next slide. And I think we go to the next slide for reflective listening. One of the most important and challenging skills required for motivational interviewing is reflective listening. It is active listening. It's listening both to the words that are spoken as well as the emotions that are behind the words. It helps to keep the person talking, and it forces you to listen carefully because it's very hard to reflect back to an individual what they said if you're not listening very carefully. And it lets you check that you understand what the person is saying. And it's always good that if you don't have it right, to be checking so that you make sure that you're on the same wavelength. Next slide. Silence is golden. So when you're working with a patient using motivational interviewing, you want to wait for the person to speak. You don't want to jump in with another question or another reflection. And you want the person to talk most of the time. We have an 80-20 rule where we like to have the patient talk 80% of the time and the clinician talk 20% of the time. So don't be afraid of silence. If you wait a little bit, no one likes silence, and if you can hold out, that person will speak. And hopefully they'll continue to speak and feel a little bit like they can open up. You can count slowly to 10 before jumping in with another question. But of course, if you get a little ways and you're not getting anywhere, then surely you can start by asking another question. Next slide. And then summarizing. Summarizing is a brief statement that links together and reinforces key parts of the conversation, such as thoughts, concerns, plans, or reflections. And the fifth and final area is providing information and advice with permission. It's okay to provide the patient information and advice, but usually we first ask if this is what they want you to do. You want them to come up with the ideas for change themselves, and you want to affirm and reinforce them. So if they want information, ask, and would you like me to give you some ideas or how to change your behavior? And I have to say there's not anyone who's ever told me no. So sometimes it's, I'd like to provide you information that someone else has shared with me. Is that okay with you? Next slide. We want to reduce discord or resistance by using reflective listening, by using empathetic statements, by focusing on building the relationship rather than change. As I mentioned earlier, when you talk with pre-contemplators, this is a time for you to build that rapport, that hopefully it's someone you'll be working with again, that they feel more comfortable, and maybe the next time you speak with them, they'll feel more open to talking about changing their behavior. Engaging people by first discussing issues that are important to them and emphasizing that the issue of whether or not to change is their decision. Next slide. So clinician behavior is characteristic of motivational interviewing is seeking to understand the person's frame of reference, particularly using reflective listening, expressing acceptance and affirmation. Eliciting and selecting reinforces the patient's own self-motivational statements, and it monitors the patient's degree of readiness to change. It affirms the patient's freedom of choice and self-direction. Next slide. So motivation is a combination of importance and confidence. Next slide. Importance, how important the person feels changing their behavior is. The level of importance is based on the individual's benefits that they see from changing their behavior. The person may see the benefit, but may have other priorities in their life at that time. Next slide. Confidence, how confident or sure the person is about their ability to change their behavior. The person may have barriers to making a change, and small steps to change can help increase their confidence for further change down the road. It's important to discuss both importance and confidence in order to develop a realistic plan of action for change. Next slide. For importance, we can use what we call the readiness ruler. And again, there's two parts, the importance and confidence. We start out with importance, and we ask important component of the importance is an important component of intrinsic motivation for change. You can use a ruler with gradations from 0 to 10. Now, many patients are familiar with that scale because we've asked them so many times about their pain on a scale from 0 to 10. You could actually use a ruler if you like, or just use the 0 to 10. You would ask them, how important would you say it is for you to change your behavior? So how important would you say it is for you to be more physically active? On a scale from 0 to 10, where 0 is not at all important and 10 is extremely important, where would you say you are? Next slide. After the person gives you the number, ask them, why did you choose? Let's say 5. So why did you choose 5 and not a lower number, like maybe 1 or 2? Now, of course, if they choose 0 or 1, you would ask them why did they choose such a lower number. Their answer will tell you what benefits they see to changing their behavior, and you can reflect on those reasons. You don't want to ask them why a 5 and not a 10, because in doing that, you're actually helping them argue against change. Next slide. Then you would ask, what would it take to move your number a little higher? Their answers will tell you what would motivate them to change their behavior, and then again, using reflections on their response. Next slide. Confidence is also an important component of intrinsic motivation. You use a ruler again with gradations from 0 to 10, and you would ask, how confident would you say you are that if you decided to change your behavior, if you decided to be more physically active, you could do it? On a scale from 0 to 10, where 0 is not at all confident and 10 is extremely confident, where would you say you are? And you'll notice that it's phrased a little bit differently, that is phrased such that you could make that change if they wanted to. And this allows the confidence to be somewhat detached from the importance. After the person gives you their number, ask them, why did you choose, let's say, a 6, and not a lower number, like maybe a 3 or 4. Their answer will tell you what helps them feel confident to change their behavior. And again, you can reflect on their reasons. Again, you do not want to reverse and ask them why a 6 and not a 10, because again, this is an answer that would argue against change. Next slide. Then you would ask, what would it take to move your number a little higher? Their answer will tell you what would increase their confidence to change their behavior. And again, you can reflect on their response. Next slide. So in terms of importance and confidence, it is something that you can use with your patients as you're working with them, just as a check-in to see about their importance and their confidence. If something is not important to the individual, there's probably no reason for them to want to make a change. If it is important, but they lack the confidence, it is up to us to help them, to encourage them, to provide them ways in which they can increase their confidence in order to go ahead and make that change that they do want to do. Another skill or another technique that you can use with your patients is what's called decisional balance. And people experience competing motivations because there's both benefits and costs associated with both sides of the conflict. That means you can have a benefit for making a change, but there's also a cost for making a change, as well as a benefit for not making a change and costs for not making a change. Next slide. So this is a little hard to read, I know, but there's a box there, and at the top you would have benefits or pros, and the next box would be cons or costs, and then the top row is making a change, and the bottom row is not changing. And you can ask your patient to fill in the boxes for them to see what exactly is going on. What are the benefits to changing? What are the costs to changing? What are the benefits to not changing? What are the costs to not changing? And so this gives them a little bit better view and helping them to decide on whether or not they want to make this change. I know this was a very brief and quick overview of motivational interviewing. And if you're interested in MI, again, I would encourage you to take a course so you can practice these skills, because these are skills that definitely need some practice. Next slide. These are some resources for you. The website for motivationalinterviewing.org is the website for the Motivational Interviewing Network of Trainers. There's information that you can utilize without being a member. And then the two textbooks that are really quite beneficial. The second one, Rolnick and Miller and Butler, 2008, is actually currently being updated. So we hope to see a new version of that coming up soon. Next slide. And now I'm ready for questions.
Thank you very much, Dr. Ehrlich-Jones. That's, like you said, a nice quick overview of motivational interviewing. I know that it is it can be quite a lengthy process or an involved process, and as you and I were talking before the presentation, that it is a skill, and something that definitely takes some education for the interviewer to learn and some practice. So for kind of taking that out to a clinic setting where, perhaps some of our listeners are in a physical therapy clinic, or even a physician or a clinician seeing a patient, and maybe they only have just a few minutes, what do you think you can make good progress with even some of the questions like you described for importance and confidence, even that scale of 1 to 10 to get people thinking in terms of changing behavior?
Sure, absolutely. Motivational interviewing can be done anywhere. It's done quite a bit in healthcare. It's done in the emergency room where you'll have maybe only a few minutes to speak to people. And you don't have to do all pieces of motivational interviewing. Maybe it's just using some open-ended questions to try to get the person to start talking and maybe moving in that direction. If it's somebody that you see on a consistent basis, or you're going to see for several sessions, it's a way in which to get started. And certainly the importance and confidence doesn't really take a whole lot of time. I think once you get the hang of asking those questions, it goes pretty quickly, and it gives people a chance to start thinking about their behavior change. I do have to say, though, importance you could certainly ask at the beginning of a conversation with the person. The confidence may take a little while. You may need to have a little bit more information from them to be able to kind of work in that direction in terms of the confidence aspect.
Great. So I wanted to remind folks that you can type your questions in the chat window down in the lower right, and we have had one person type in a question so far. Michael asks, what is the research on motivational interviewing effectiveness for patients with OA?
Oh, Michael, that's a really good question. There is some research out there. The research in motivational interviewing in general is mixed. You will find studies that find it effective, and you will find studies that will not find it effective. I think there's more and more research that needs to be done, and that's part of my goal in terms of what I do in getting more research out into the literature. I would say at this point, you have to think about this. If you think about behavior in general, is very individual, and sometimes it's very difficult to change people and change their behavior. So I would say it's mixed, and we're looking for more.
Yeah, and I'd say whenever you were answering the question, I'm thinking back to the Walk with the Doc program that some folks who are listening are familiar with, and this kind of gets to the heart of the challenge of behavior change. The Walk with the Doc program briefly was started by a cardiologist who forever was trying to get his patients to be more physically active. Was always telling them in clinic visits, exercise is good, you should exercise more, and all patients would say, yeah, I know. But nobody actually was really doing it or doing it with any real fervor. So he basically, took it a step further. It kind of leapt over the motivational interviewing, but he physically asked people to join him and his family out in a park on a Saturday to take a walk with them, and it kind of grew from there. But it really takes a lot to get people to change behavior. So I think it's certainly a good start to ask probing, pointed questions like you've described in motivational interviewing, instead of just telling people, you should exercise.
Exactly, and I think part of it, too, is for people to come up with the ideas themselves on what they would like to do, because people will be very polite, and, we'll ask them to go out and walk, and we'll ask them to go out and do things, and they'll nod their head yes and walk out the door and say, there's no way I'm going to do that. And if you have the chance to probe a little bit further and find the things that they're interested in doing, then they're more likely to follow through on something like that. And whether it's walking with a friend, but it's finding out what that person in particular would like to do.
I agree. I think that's very true. We've had another question come in from Marty, who asks, what are some strategies you have used to build confidence?
Wow, that's a good question, Marty. So I guess one of the things you can do is you can ask them about things that they've done in the past that they've been successful at. So even if it's not something that's related to what you're talking about, let's say physical activity, but maybe they've been successful at weight loss, or maybe they've been successful at doing some, going back to school or things like that. So probing a little bit more about things that they've done in the past that they were successful, and kind of go through and ask more questions about how they went about doing that, and help bolster the idea that they were successful at something in the past, because success usually begets success. And once somebody starts to be successful at something, then they feel like they can be successful elsewhere. So I think it's a technique actually we call looking back, and it's something that we look back to see what types of things they were successful in the past.
Yeah, I think that makes a lot of sense, and certainly somebody may not recognize the connection between a prior success and the current challenge. So I think drawing that dotted line from one place to the next really helps people open their eyes to what's possible.
Mm-hmm.
Thank you. Okay, so we'll give everybody another minute to think of a question, type it in. I'll just, in this time, give a quick announcement for our next webinar while people are gathering their thoughts. On April 19th, we'll have a webinar with Dr. Susan Hughes at the University of Illinois Chicago talking about the evidence-based physical activity program called Fit and Strong. So hopefully you will be able to join us for that. And no other questions at the moment. Certainly anybody who has something they thought of after we all disconnect, you can email me or email Dr. Ehrlich-Jones, and we'll get those questions answered for you. We will have this posted this afternoon, so be on the lookout for that. And in the meantime, thank you very much, Dr. Ehrlich-Jones. Very informative.
Thank you for having me.
Have a great day, everybody, and we'll see you next month.